I am in the Des Moines office, as I said. My name is Lisa Brecky. I have my bachelor's in psychology from Iowa State and my master's from Concordia University in St. Paul. And then I got my doctorate in physical therapy at Sacred Heart University in Connecticut. And then I did a one-to-one mentorship at Access Balance and Vestibular Center in Connecticut for a year before taking over as director. And then I moved here to Des Moines in October. And my training is the one-to-one mentorship, a lot of continuing education, and then the Emory Competency Certificate that I took in Salt Lake City. I'm currently growing a vestibular and concussion practice at Kinetic Edge Physical Therapy in the Des Moines office, and have contacts with all the other offices that have questions as they're running into new things. The objectives for today's course is in the webinar is to provide you with information and details that you should be providing to your doctors for your appointments to make them a little bit more beneficial, to improve awareness of multiple causes of dizziness, to discuss possible treatment options that are available and the types of providers you may see, and then provide education on the importance of a proper evaluation by a physical therapist to help direct your care. So first, we have to talk about how we maintain our balance. And we use 3 systems to do this. We use our vision, our inner ears, which is our vestibular system, and proprioception, which is basically where we are in space, and we use our feet for that one. Your vestibular system is the most important system, and it's often overlooked because it's so small, and when it's functioning, it's great. I have a laser on here, so I'm going to point out some important features. So this is your outer ear, and then you have your ear canal where you get your earwax, your eardrum. This is your middle ear that drains down into the back of your throat. And then deep in here is your inner ear structure, which is where our vestibular system and our cochlea sit. These 2 are really important for your balance, and that includes your hearing. And if one of them is off, it can throw off your whole system. And if this little guy with the canals is off, it can make you feel dizzy, it can make you feel off, you can be imbalanced from it. So this is an important system for you to have working. It's the size of your thumbnail, and often doesn't bother you unless it's not working properly or not integrating correctly within your brain. Which leads us to this picture of our brain. And the highlight on this one, you don't need to know this, it's just that our vestibular system feeds to multiple parts of our brain. So there are different reasons that you can be dizzy that are caused by the brain or the inner ear, not just one. So the next question is, I'm dizzy, now what? And the most important thing is you need to ask yourself some questions so that you can go to your doctor a little bit more informed. If you go and say that you're dizzy, your doctor may look at you like a deer in headlights and not know quite what to do. And they may just refer you to the first provider that comes to their mind, even if it might not be the right match for you. So the first question you need to ask is, how do I describe it? And there are multiple ways to describe it. You can say that you have vertigo, which is spinning, imbalance, foggy, floating, drunk, and motion sick. Linda, you're on here. Do you experience dizziness at all or know anybody that has it? I experience. How would you describe it? Imbalance and motion sickness. That's great. And that's a great thing to know for your doctor too, because if you walked in and said dizzy, they may think something different. So being very specific with the words imbalance and motion sick helps guide them both in your treatment and getting you to the right provider for follow-up. Thank you for sharing that. The next question you should be asking is anything provoking it or causing it? So is it only occurring when you change positions, which is likely with positional vertigo or BPPV? Does it happen with quick motions of your head or movements of your body? And then does it happen with busy scenarios like being in a grocery store or around a lot of people at a mall, or even driving can be a busy scenario. And those are really important because each one indicates a different form of diagnosis that can be prompting your dizziness. So they're good questions to know. And then these questions are something that you should consider. And I always recommend writing down everything you can think of before you go to your doctor's appointment, because as soon as the doctor walks in and asks how you're doing, it goes straight out of your brain and we forget why we came there in the first place. So it's really important, if you're dizzy, to describe the best you can. So like we said, finding a word that's not dizzy. You can say dizzy, but then being able to elaborate on that. How long has it been happening? How often it occurs? How long do the episodes last? Is it brief, like positional vertigo, where you kind of roll over or you stand up and you're dizzy for a few seconds to a minute and then it goes away? Or does it last seconds, minutes, hours, days? That will really help your diagnosis as well. Are there certain scenarios that provoke it? Do you have symptoms while you're just sitting, or do you have to be moving? Does anything relieve it? And have you tried any treatments? And this includes anything over the counter, because oftentimes I recommend supplements or just basic things over the counter that patients can trial. And that's important because that'll help you with a diagnosis if they are helpful and even if they're not helpful. So the next one is, I'm just going to go over a few things that cause dizziness, just so you have a general idea of the fact that it's not just one thing. So what your neighbor says may be helpful, may not be.
Looks like we have a question about the supplements that you recommend. Is that a handout that you'd be willing to provide at some point in the follow-up email or something like that?
Yeah, I can send a follow-up email. Linda, if you can just put your first and last name, you're on a registration list, and we can send you an email with the supplement list.
Perfect.
There we go. So there are multiple causes of dizziness. The first one is our inner ear, which is the most common form of dizziness. So our inner ear can have benign paroxysmal positional vertigo, which is known as BPPV, or if you're talking to your doctor, can be crystals in your inner ear. And that causes dizziness when you change positions because they become gravity dependent. So if you're up and moving, they usually don't bother you. You may feel a little bit imbalanced, but in general, you're okay. But then if you roll over in bed or you bend or look up, then you can have problems there. Vestibular neuritis or labyrinthitis is an inflammation of your inner ear nerve that can cause severe acute dizziness that starts to fade over time, but leaves some residual dizziness with quick motions. Acoustic neuroma is often asymptomatic unless you have an underlying visual deficit or it's faster growing, but typically they're slow growing and you don't notice it until they're a little further along. They require either monitoring or they do surgery to remove them with vestibular rehab post. Maladie-Debarquet syndrome is a syndrome that occurs when you've had a lot of passive motion. So people often say coming off of a cruise ship, or if they've been in a mobile home for a prolonged period of time with movement, they still feel like they have this sense of moving as they get off of the passive range of motion, passive motion. Meniere's disease is an inner ear dysfunction that they don't quite understand very much right now, but it has hallmark signs of spinning, ear pressure, and ringing in your ears. And then there's semicircular canal dehiscence, where there's a hole in one of your canals that adds an additional window to your inner ear and causes dizziness and some additional symptoms. There's fistula, where a fistula has grown and causes the problem there. Ototoxicity can occur with certain medications and drugs that they use to treat One of the big ones is an antibiotic that they use if you have a heart condition. It's strong and ends up killing all the hair cells inside your inner ear. Most people have a decreased inner ear function on both sides from this. And then there's spatial motion sensitivity, which is not an inner ear diagnosis, but is often caused by decreased input from the inner ear and an over-reliance of your vision. And then there are other causes that can contribute to a vestibular dysfunction. So cervicogenic dizziness is a big one. If you have a neck dysfunction and you're not moving your head, you're not feeding your inner ears, and that can cause a decreased function in those inner ears. Linda, yes, ototoxicity can be caused by chemotherapy. Different agents can cause it. There is migraine-associated vertigo or vestibular migraine, and there's stroke. So all three of these can cause increased dizziness due to the vestibular system, secondary to actually causing a defect in the vestibular system. And then there's other causes that are just outside of the system, and that includes cardiac implications, medications, orthostatic intolerance or hypotension, dysautonomia, peripheral neuropathies, stress, tumors, and vision. And all of these indirectly affect part of your body and can cause a sense of imbalance or dizziness. So then possible treatments that are based on the diagnosis. As you'll see in the next two slides, physical therapy, vestibular rehabilitation can be helpful for all of them, because even if they're not directly related to the inner ear, they often cause a significant amount of time where you're not up and moving. So you can have weakness and just sensitivity in general from the lack of movement. The big ones to see your physician for is most of what causes dizziness requires you to at least follow up with your vision to see if there's anything underlying that's causing it, and to make sure if you need additional imaging to follow up and provide surgery if needed, like would be needed for the acoustic neuroma, the superior canal dehiscence, or even a brain tumor in the following ones. So physical therapy is really important throughout, because not only can we directly affect the symptoms that you're having, we can also help you find a diagnosis. So most patients see used to be 8 providers before they got the correct diagnosis. Now it's about 4 to 5 providers before they're getting correctly diagnosed with what's causing their symptoms. However, that's a lot of providers to be seeing before you are correctly diagnosed, and that's a lot of time spent seeing providers, because the specialist, like a neurologist, can take 6 months to get in to be seen. So then you're waiting with symptoms for 6 months. In the meantime, physical therapy is direct access in the state of Iowa, and most insurances allow you to come to physical therapy without a physician referral, which means that we can take a look at what's going on. We can talk to you about your symptoms. We can talk about your medical history. As pointed out before, chemotherapy can be a huge component for degrading the inner ear. We can check your neck, your inner ear, your vision, and just the way your system is integrating to see where the deficit is and make sure that you're not only getting better with us, but you're following up with the right provider. Linda, do you have any other questions that I can answer? Oh, that's good. I'm glad you went to PT. That can be really helpful. So oftentimes, I can talk a little bit about the supplements, since that was a question you had. The big thing is what you're coming for the dizziness for supplements. Positional vertigo, we recommend that you treat anything that's underlying. So if you have BPPV and it's recurring frequently, making sure that if you have high blood pressure, high cholesterol, that those are being treated. If you have osteopenia or osteoporosis, that you're addressing those, and that you're having your doctors check for vitamin D deficiencies, because those are often at increased risk for reoccurrence for positional vertigo. And then for migraines and vestibular migraines, we highly recommend magnesium as the primary supplement. I can send over the information in regards to that with the research and the recommended dosing. We do always recommend that you talk to your physician even with supplements, because they can interact with other medications, and magnesium can have a tough time on your kidneys. So just making sure that you're also collaborating with your doctor, even if it's just sending over a message about wanting to try a supplement. Oftentimes they don't tell you no, but it's really good to know that you're not mixing it with something you shouldn't be mixing it with, and it's going to be the best benefit for you. Another common question that I get is why people are imbalanced or dizzy if they have peripheral neuropathy or a vision problem, because that has nothing to do with the inner ear. And I like to tell them that it just has to do with the 3 balance systems that we talked about at the beginning, with the inner ear, your eyes, and your feet. We need all 3 to work optimally, and we need at least 2 to be upright. So even if one of those is not working, then it's really important to make sure that the other 2 are nice and strong, which is where physical therapy comes in, because oftentimes our brain doesn't integrate them correctly when one of them goes offline. So if you get peripheral neuropathy and you have decreased sensation in your feet, then your vision and your vestibular system need to be stronger, and they don't automatically make that adjustment. And so that's where PT comes in, where we work with you and make your balance better by integrating your vision and your vestibular system more. And then same thing with vision. If you have a vision change, that can make you susceptible to being motion sensitive or dizzy or imbalanced. But it can also cause problems if you have a vision change and you have an underlying vestibular disorder like an acoustic neuroma that you haven't been correctly diagnosed with, or just have been asymptomatic with for a long time, because your vision will take precedent and your vestibular system won't be able to recover from that. And so that's another reason PT is helpful, because we can help tease out those systems and see what's really contributing to your problem. One of the really important things to look for if you're going to a vestibular rehab is not only that they say on their website that they treat vestibular dysfunctions and they have vestibular rehab, it's the equipment as well. They don't have to have a bunch of high-tech balance equipment, but they should have goggles, infrared goggles or Frenzel goggles. Infrared goggles are better than the Frenzel goggles, but Frenzel goggles work in a pinch, because our vestibular system is in our inner ear. Our brain can compensate for the visual stuff that your physical therapist is looking for. And so if you don't have the goggles on, you may be able to fixate on something in your vision and cancel out that eye movement. So it's really important to have goggles that put you in the dark, that allow the therapist to see your eye movements without you being able to fixate. So we can really see, is it your inner ear or your brain that's causing the dizziness, and exactly what could be causing that. Linda, I like only sudden vision changes or slow changes. Oftentimes it depends. Slow changes occur, so that's normal as we age to have vision changes as we age. But if they occur at the same time that maybe your vestibular system isn't working as strongly, it may bother you. So it is really important to do regular check-ins with your eye doctor to make sure you're getting your glasses updated and making sure nothing's going on with your vision. The other important thing is the difference between an optometrist and an ophthalmologist. So an optometrist only cares that you can physically see something and like the health of your eyes in general. But an ophthalmologist is going to look at how your muscles in your eyes are functioning and if you're able to use both eyes at one time or if you're substituting and only using one. Both of those things can cause a huge upset in our system and cause us to be really off balance because it takes a lot of brain power if the muscles aren't working or one eye is only working more than the other. So sometimes if you're finding that you swear it's your vision and you've been to an optometrist repeatedly, I would look into seeing an ophthalmologist to see if they can do a deeper dive into what's going on with your vision. And then sudden vision changes can also play a big role in the way your system reacts as well. Slow changes are easier to compensate for, but when in regards to our vision, it can be a lot harder. Okay, Linda, do you have any other questions? Or Katie?
I think you gave a nice overview.
We'll wait and see if Linda has anything else she wants to ask. You don't remember if your therapist used goggles. You would most likely remember because they put you in the dark and then they move your head around. So most people that kind of sticks in their brain that they had to do that with their therapist, but you can always call them and ask them. The front desk should know if they use infrared goggles because they're not super expensive, but it is a pricey point for them. Our Newton location doesn't use them. So oftentimes our other locations, I'm glad I could answer that. Oftentimes our other locations have been seeing these patients without the equipment because they don't see them a lot. So they do the best they can and they refer out when needed. Now that I'm in the Des Moines location, it's nice to be able to collaborate with them and they send patients into the Des Moines office if they need additional testing for one reason or another, whether they're not getting better or they need a more extensive look at them. Okay, so I'm going to wrap up. Linda, if you have additional questions for me, I can reach out to you individually. And then just remember with all of our locations with Kinetic Edge Physical Therapy, we do offer free screens. What we do for those is we talk to you about your symptoms, previous treatment, current treatments, and what got you into coming into therapy in the first place. And then we decide if physical therapy is a good fit for you or if you need to see maybe a specialist before starting physical therapy, depending on where you're at in your journey. So you can give us a call at 515-309-4706 to set that up. Or if you're in this webinar, you can also submit your first and last name and we can give you a call to get that set up. Linda, thanks for joining us, and anybody who watches, thanks for joining the webinar.